Welcome to the Omni podcast. Today, we're diving deep into a decision, a choice that many of you might be thinking about. Invisalign versus veneers. It's a big one, right? Are you looking for a fundamental change to your smile structure or maybe more of an instant cosmetic boost? Our mission today is to sort of cut through the noise, really get to the core differences, maybe some surprising overlaps too, and help you figure out the best path for the smile you want. Now, before we jump in, just a quick word about Omni, who make this deep dive possible. They're located right in Arlington Heights, Illinois. Dr. Billis Poles and his team there, they're really known for fantastic, comprehensive dental care. They serve Arlington Heights and, nearby communities like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, Elk Grove Village, basically the whole area, really committed to top-tier treatment.
Yeah, and that commitment to comprehensive care really ties into today's topic perfectly. Because, it's fascinating. Both Invisalign and veneers, they can totally transform a smile, right? But they address fundamentally different things, really different. Invisalign, that's all about the underlying structure, straightening teeth, fixing the bite. Veneers, on the other hand, are more like a beautiful new surface. They mask imperfections that are already there. So it's not about saying one is, inherently better. It's about matching your specific goals, your current dental health, and what you see for yourself long term with the right approach.
Okay, right. Let's unpack that first option then, Invisalign. Many listeners probably have a general idea, clear aligners and all that, but can we dig in a bit? What exactly is Invisalign and how does it actually, work its magic?
Okay, so basically, Invisalign is an orthodontic treatment. That's the key category. Its main job is to correct how your teeth and jaw line up. How it does it is through a series of custom-made, clear plastic aligners. They look a bit like thin mouth guards. You wear each set for about a week or two, usually, and they apply these very gentle, controlled forces. It's all precisely calculated to gradually shift your teeth into the desired spot. It's super popular, especially for people with, crooked teeth, bite issues like overbites or underbites, or even just mild crowding that makes cleaning difficult. The real appeal is how subtle it is and how it works step by step.
Yeah, that discreet part is definitely a huge plus for many people. But aside from being nearly invisible, what are some other advantages? Maybe things people don't realize until they're actually doing the treatment.
Oh, absolutely. The invisible aspect gets the headlines, sure. And it's a big deal socially compared to traditional braces. But honestly, a massive benefit, one that people really appreciate, is that they're removable. You take them out to eat whatever you want, to drink anything besides water, and, critically, for brushing and flossing. That makes keeping your teeth clean so much easier than trying to navigate around brackets and wires. It's a huge difference for oral hygiene during treatment.
Okay, that makes a lot of sense. Hygiene must be simpler.
Way simpler. And then there's comfort. Most patients find it generally less painful than metal braces. You might feel some pressure, maybe a dull ache for a day or so when you switch to a new aligner set, but it's usually not that sharp, pokey feeling you can get with braces, that comfort factor. It really helps people stick with wearing them consistently. And thinking bigger picture, the most crucial benefit is probably how it improves your overall oral health foundationally. When your teeth are straight, there are fewer tricky spots for plaque to hide. Cleaning is more effective. So long-term, you're reducing your risk for cavities and gum disease. It's health and aesthetics working together.
That's a really important point, the health benefits beyond just straight teeth. So you've got the look, the hygiene, the comfort, big wins. But time commitment is always a factor, isn't it? What's the typical timeline someone should expect with Invisalign?
You're absolutely right. It's a commitment. The exact time varies a lot. It really depends on how complex your situation is, how much movement is needed. But generally speaking, most treatment plans fall somewhere between 6 and 18 months. Some simpler cases might be faster, maybe just a few months. More complex ones could take a bit longer, maybe closer to 2 years. You're changing aligners every 1 to 2 weeks, typically. And the key, really the absolute key, is wearing them consistently, like 20 to 22 hours a day. That keeps things on track.
Okay, 6 to 18 months, wearing them almost constantly. Got it. You also mentioned it's reversible. What does that actually mean in practice?
Good question. We need to be precise here. The treatment itself isn't something you can just undo easily once teeth have moved. What reversible really refers to is the outcome. If you finish your Invisalign treatment and don't wear your retainers as prescribed afterwards, your teeth can shift back. So while the aligners come out, the commitment to keeping that new smile, that involves wearing retainers, often at night, pretty much indefinitely, for life, for many people. So the process ends, but maintaining the result is a long-term thing. Does that make sense?
Yes, that clarifies it perfectly. The result needs ongoing maintenance. Thanks. Now, this is where things get really interesting for comparison, right? Because on the other side, we have veneers. How are they so different from Invisalign, given that both aim for a better-looking smile?
Totally different ballgame, yeah. The fundamental difference is their function, their core purpose. Veneers are these super thin shells, usually made from beautiful dental porcelain, sometimes composite resin. They're custom made for your teeth and then meticulously bonded onto the front surface. So unlike Invisalign, veneers don't move anything. They don't fix orthodontic problems. They essentially act like a new front for the tooth. They cover up cosmetic issues right there on the surface. Think of it like, like giving the tooth a permanent, perfectly designed facade.
A facade. Okay. So if Invisalign is fixing the alignment, what kind of issues are veneers really good at solving? What are the main benefits from that cosmetic angle?
Veneers are amazing for delivering an almost instant aesthetic upgrade. The results can be incredibly fast. They're fantastic for things like severe staining or discoloration that whitening just won't touch. Also great for fixing minor chips, small cracks, or even closing small gaps between teeth where you don't need full braces. And here's a cool thing. They can make slightly crooked or misshapen teeth look perfectly straight and uniform without actually moving them orthodontically. They let you change the shape, the size, the color, create a really harmonious, often brighter smile.
Wow. Okay, so they can make crooked teeth look straight. That's quite something. You mentioned they're bonded on. Does that involve doing anything to the natural tooth first?
Yes, and this is a really important point. To get that seamless, natural look and feel, a small amount of the tooth's front enamel surface usually needs to be removed. It's a very precise process, just enough to make space for the veneer so it sits flush and doesn't look bulky. It's kind of like preparing a canvas for a painting. You need that perfectly prepped surface for the porcelain to bond strongly and look totally natural.
Right, removing some enamel. That sounds...
Exactly. And that leads to the biggest consideration with veneers.
What are the main concerns people usually have when they hear about this? How do you address those?
Well, the number one thing, which we always emphasize up front, is that veneers are an irreversible treatment. Once that enamel is removed, even if it's a tiny amount, the tooth is altered. You'll always need that tooth to be covered by a veneer or maybe a crown later on. It's not like Invisalign where if you stop wearing retainers, things might shift back. This is a permanent alteration to the tooth structure. It's a long-term commitment.
Okay, irreversible. That's a major factor.
Definitely. People also sometimes worry, understandably, will they look fake?
Mm-hmm.
And that's where modern materials and the skill of the dentist come in. High-quality porcelain veneers, when done well by an experienced cosmetic dentist, can look incredibly natural, indistinguishable from real teeth, really. They match the light reflection, the subtle textures. The goal is beautiful and believable. Cost is another factor, of course. Veneers can be a significant investment, particularly if you're doing several teeth to create a full smile makeover. We discuss all this very openly, making sure you understand the pros, the cons, the commitment, everything, before making a decision.
That permanence really highlights the difference. And you mentioned speed. Just how fast can someone see results with veneers compared to the months we talked about for Invisalign? What's that process like?
The speed for the cosmetic result is dramatically faster, worlds apart, really. Because it's a cosmetic procedure, not orthodontic, there's no waiting for teeth to move. Typically, the whole thing can be done in just 2 or maybe 3 dental visits, often spread over just a couple of weeks. The first visit is usually for planning, preparing the teeth at enamel removal, and taking detailed impressions or scans. You might leave with temporary veneers that day. Then, once your custom porcelain veneers are back from the dental lab, you come in for the second visit, and that's when they're permanently bonded onto your teeth. So yeah, you can walk out with a completely transformed smile very, very quickly. That speed is a huge draw for some people.
Wow, 2 or 3 visits. That is fast.
Yeah.
Okay, so putting it all together, if someone listening is trying to boil it down, what's the absolute biggest, most essential difference they need to keep in mind when comparing Invisalign and veneers side by side?
The absolute core distinction. It's purpose and function. What are they designed to do? Invisalign moves teeth. It's orthodontic. It corrects structure, alignment, bite. It improves long-term function. Veneers cover teeth. They mask imperfections. They're cosmetic. They enhance appearance without changing the underlying tooth position. So maybe think of it like this quick summary. Purpose. Invisalign corrects structure. Veneers enhance appearance. Best for. Invisalign tackles crooked teeth, big gaps, bite problems. Veneers are great for discoloration, chips, small gaps, reshaping teeth. Type of procedure. Invisalign is orthodontic. Veneers are cosmetic, restorative. Time. Invisalign takes months. 6-18 typically. Veneers, just 2-3 visits usually. Reversibility. Invisalign's outcome needs retainers to stay put. Veneers themselves are irreversible because of the enamel preparation.
That summary really clarifies the functional divide. Thanks. But choosing isn't just about function and time, is it? What other, maybe deeper factors should our listeners really be weighing up when making this kind of personal decision?
Oh, absolutely. This is where that detailed chat with your dentist is so vital. Several key things to consider. First, and maybe foremost, is overall oral health. Invisalign, by aligning teeth properly, actually improves your ability to clean them, potentially reducing future dental problems. It works with your natural structure. Veneers look fantastic, but they don't fix underlying bite issues, and while they're strong, they are restorations placed on altered natural teeth. You still need excellent hygiene to maintain the health of the tooth underneath and the gums around them.
Okay, so think about the long-term health impact. What else?
Then there's budget and cost, naturally. Veneers often have a higher upfront cost per tooth, especially for porcelain. But the results are fast. Invisalign costs vary a lot depending on how long your treatment is. Sometimes orthodontic insurance might cover a portion of Invisalign, which usually isn't the case for purely cosmetic veneers, so you need to look into that.
Right, insurance is a practical point. What about the day-to-day experience?
Exactly. Commitment and maintenance. This is huge. Invisalign demands real discipline. Wearing those aligners 20 plus hours a day, every day. Keeping track of them, cleaning them, switching them on schedule. It's an active role you play. Veneers, once they're bonded on, feel pretty much like natural teeth. You brush and floss normally. But they can chip or break under excessive force, just like natural teeth, and they don't last forever. Porcelain veneers typically need replacing every 10, maybe 15 years, sometimes longer, with great care. So there's a future replacement cost and process to factor in.
So different kinds of commitment required for each.
Different kinds, yeah. And finally, maybe the most crucial piece, your personal goals and expectations. What is your priority? Is it achieving that ideal alignment for better long-term function and easier cleaning, even if it takes time? Or is the main goal that immediate dramatic cosmetic change to fix surface issues? Understanding it involves permanently altering your teeth. It's really about aligning the treatment with what matters most to you and what you want your smile to represent.
It really sounds like there's rarely a single right answer, just the right answer for the individual. But you hear sometimes, are there situations where someone might actually get both treatments, like combining them?
Oh, absolutely. That's an excellent point, and happens more often than you might think. It can be a fantastic approach for complex cases. For instance, someone might have significantly crooked teeth and some deep staining, or maybe a chipped tooth. So they might start with Invisalign, use that to get the teeth into the right position, fix the bite, create that healthy foundation. That could take, say, a year. Then, once the teeth are properly aligned, they might get veneers placed on just a few specific teeth, maybe the front ones, to perfect the color, shape, or hide that chip. It allows you to get the best of both worlds. The functional correction from orthodontics and the ultimate aesthetic refinement from veneers.
Okay, so you fix the structure first, then perfect the appearance.
Exactly. It requires careful planning, of course. You need to do things in the right order, usually orthodontics first. But yeah, combining them allows for a truly customized, comprehensive smile makeover when needed. It's about using all the tools available to get the ideal result.
That's really good to know that it's not always an either or choice. Well, this has been incredibly insightful. We're nearing the end of our deep dive here. It seems clear the choice between Invisalign and veneers is super personal. It really hinges on your specific goals, your current dental health, what fits your lifestyle, and yeah, the budget too.
Precisely. And that's why the single most important step anyone listening can take is to schedule a consultation. Sit down with a qualified dentist you trust. Talk openly about your teeth, what you hope to achieve, how you live your life. They can examine your specific situation, explain how each option applies to you, and help you make a choice that truly supports your smile goals, not just for looks, but for long-term health and confidence too. It's about making an informed decision that feels right.
Great advice. And if you happen to be in the Arlington Heights area and are thinking about these options, remember Omni Dental. Dr. Poles and his team are really leaders in this kind of comprehensive care. You can reach Omni Dental at 847-483-8833. Or just schedule online through their website. Take that first step. Their office is at 305E Rand Road, Arlington Heights, IL 6004.
And perhaps this leaves us with a final thought to consider. Beyond the immediate look of your smile, how might choosing between fundamentally correcting your dental structure versus cosmetically masking imperfections influence your long-term perspective on maintaining your oral health and maybe even your confidence in your natural smile? Something to think about.
That is a fantastic question to ponder. Thank you so much for breaking all that down for us today. And thank you all for joining us on this deep dive. We hope you feel more empowered about your smile choices. We'll catch you next time.